Hello, everybody. Welcome to Human Anatomy and Physiology online class. And today we're covering joints. So let's go ahead and begin. So how we can classify joints? We can use structural classification and functional classification. Now, structural classification means you will see what really holds two bones together. Because what is a joint? Joint is connection between two adjacent bones, and bones are never directly connect to each other. There is always some other tissue between them, and depends what type of tissue is between two bones. We have this structural classification. Okay, sorry for that. So if we have fibrous connective tissue between two bones, then it will be a fibrous joint. And this is dense regular connective tissue. If we have cartilage, it can be hyaline cartilage or fibrocartilage between bones, then it will be cartilaginous joint. And if we have pretty complex structure of a joint, like shown on a picture over here, and most important, we have a capsule between two bones, then we call it synovial joint. So bones are not directly connected at articulating surfaces. There is a capsule surrounding them. So here's the capsule. And there is a fluid inside. That's structure of synovial joint. We will look into more details. Now, fibrous joint and cartilaginous joint, neither one of them has a capsule. And as I already said, we can use functional classification. Now, functional classification pretty much gonna tell you, are those joints mobile or not? Is there any movement between bones? And the first we have joints we call Synovial. And Synovial are immovable joints. It's a strong union between bones, important for protection. An example would be sutures of skull. So if you see here, lomboidal suture right there, you see squamous suture, you see coronal suture, right? So those are our fibrous joints, right? Because there is a fibrous connective tissue between two bones. So that's our structural classification. And those sutures are Synovial. That means there is no movement between bones. If we have a slightly movable joint, so it says limited mobility, then we call it amphiarthrosis. It's also a strong joint. An example would be pubic symphysis between two coxal bones, and intervertebral disc that's shown right here between two adjacent vertebrae. Here's vertebra 1 and here's vertebra 2. Now, those are amphiarthrosis. If you look at the word itself, arthrosis means joint, and amphi, like you might be familiar with, for example, amphibious animals that can live on land and in the water, right? So it kind of gives you like, there is here and there, right? Like this, it's strong, but it's a little bit movable joint. That's what amphi means. The last classification, functional classification of joint is diarthrosis. Right, so those are joints that are freely movable, right? And all synovial joints are freely movable joints, right? So on a picture over here, you see hip joint, and it's ball and socket joint, and there is a capsule, and there is a synovial fluid inside that capsule. So that's a synovial joint by structure, and it's a movable joint by their function, right? So, so that's a diarthrosis. And diarthrosis can be uniaxial when we have movement in a single plane. An example would be elbow joint. It can be biaxial, motion in two planes. An example would be metacarpophalangeal joint. So that's joint between your metacarpals and phalanges. And multi-axial when we have a motion in three planes. And example would be this hip joint, or our so we have did I stop? Okay, so it can be a hip joint or your shoulder joint, right? So again, let's review very quickly what we covered so far. So by structural classification, we can have fibrous joint, cartilaginous joint, synovial joint. And by functional classification, we can have synarthrosis, amphiarthrosis, and diarthrosis. Okay, so let's go ahead and continue. So now we're gonna look at different examples of fibrous joints, cartilaginous joints, and synovial joints, right? So fibrous joint, three types of fibrous joint shown over here is gymphosis. And this is joint that holds your teeth inside the socket of your maxilla and mandible, right? That's a gymphosis. Here's a word. Then we already talked about sutures, right? And sutures are found in your skull, and they hold your cranial bones together. And syndesmosis. So here's the word syndesmosis here over here. An example would be interosseous membrane between ulna and radius, and also interosseous membrane between tibia and fibula. Those joints, they all have connective tissue between bones. For example, interosseous membranes, the fibers are longer of this dense regular connective tissue, and in the sutures, the fibers are very short. In a gymphosis, you can see fibers shown here in this white lines over here, and it's called periodontal ligament or periodontal membrane. Now, this is structural classification. Now, this joint and this joint, they are immobile joint, right? So there is no movement. So it's a thin arthrosis. Now, this joint allows very slight movement between two bones, so it's amphiarthrosis. So here's our gymphosis. So fibrous joint that anchors teeth. It's peg and socket joint, and the fibrous membrane forms periodontal ligament. And as I already mentioned, it's synarthrosis, so no movement within this joint. Sutures. All bones of skull except mandible. Mandible, the only bone that forms movable joint. It's a fibrous connective tissue that unites adjacent skull bones and that allow for brain protection. Now here on this diagram, you see a fetal skull. And what you can notice, there are some parts of it that's made of membranous tissue. So this membrane is not ossified yet. And those areas are called fontanelles. So it's a broad area of connective tissue that gives flexibility during birth. And it's also allow the brain to grow inside this cranial cavity. All right, with time, those fontanelles, this connective tissue will ossify and become a bone in adult. In our skull, we also have joint called synostosis, right here. And this is a fusion between bones. So it's not even sutures. It really like pretty much more stronger, complete fusion of the bones. Remember, I told you there is kind of no bone connected to another bone, but I guess synostosis is example of this connection. And the bone that has synostosis would be maxilla, for example, right? It, completely fused together. Two bones of, two maxillary bones joined together by synostosis. So that's sutures. And this is our interosseous membrane over here between radius and ulna. It's a fibrous joint uniting parallel bones. When we have narrow gap between bones joined by ligaments and wide gap joined by interosseous membrane. Right, so I guess you know what ligaments connects bones to bones, and interosseous membrane fill in this wider gap between bones. This allows some movement, and that's why the joint is amphiarthrosis. Right, so amphiarthrosis is functional classification. Syndesmosis is structural classification. I know lots of this terminology, right? But we will go and review it again. So what we are talking about over here? So we said that we can have fibrous joints, right? That means it will be dense regular connective tissue, fibrous connective tissue between two adjacent bones. But now what type of this fibrous connective tissue? Well, so again, if we have like short fibers between two bones, right? So that's all fibrous joints. If fibers are short, we have sutures, and that will be found in the skull. If fibers are longer, then it will be interosseous membrane or syndesmosis, right? So it's also fibrous tissue between bones. Or it can be periodontal ligament that only found in a joint that connects your, holds your teeth in their sockets, right? So those fibrous joints can be gymphosis, sutures, syndesmosis, right? And then we say like, okay, gymphosis is synarthrosis. That means no movement. Sutures are synarthrosis too, no movement. Syndesmosis allows some movement. So what is gonna be? Amphiarthrosis. Because if you're looking at functional classification, okay, where's my functional classification? Over here. No, okay, that's not functional. Okay, so we don't have kind of like this slide dedicated functional classification, but it says over here, synarthrosis, amphiarthrosis, and diarthrosis. Right. I hope it makes sense. So fibrous joints, we covered, right? Gymphosis, sutures, syndesmosis. Now see what's going on with cartilaginous joints. So cartilaginous joint, how we can classify them based on what? Well, we're gonna classify them based on type of cartilage that connects two bones together. Is it hyaline cartilage or fibra cartilage? If it's hyaline cartilage, it's gonna be syndesmosis. If it's fibrous cartilage, it's gonna be symphysis. Right, oops, good that this disappears. So syndesmosis, joint borne by hyaline cartilage. It can be either temporary joint or permanent joint. An example would be epiphyseal plate. So that's considered to be joint because we have bone here and we have bone here, right? And there is a cartilage between them and it's a hyaline cartilage. Or it can be sternocostal joint where ribs connected to the sternum. Fibra cartilaginous, fibra cartilage, I'm sorry, between bones form symphysis. It's a strong joint. An example include pubic symphysis shown right here between two hip bones. Manubrium sternal joint. Manubrium is the kind of like upper part of the sternum, and then we have body of the sternum. That would be manubrium sternal joint, and intervertebral disc or symphysis is example of symphysis, right? So cartilaginous joint, synchondrosis, and symphysis based on type of cartilage, hyaline cartilage or fibra cartilage. And now the most complex joint, it's a synovial joint. And synovial joint has a joint capsule. Oh, I'm sorry. Yeah, and joint capsule and joint cavity. That's cavity. Here we have articular capsule, right? So here and here, and that's made of connective tissue. Now this capsule is covered by synovial membrane, membrane also made of connective tissue, but this membrane secretes fluid inside this capsule, and a fluid called synovial fluid. Also bones, they have articular cartilage covering them, right over here and here. So what do we have? We have joint cavity, right? So the whole thing over here is joint cavity made of articular capsule, right there, made of articular cartilage, made of synovial membrane, right there, and synovial fluid inside. Those type of joint is movable, right? And again, it can be different range of movement. It can be uniaxial, biaxial, multi-axial. So either movement in one plane, two planes, three planes, but all of these synovial joints are movable and they are diarthrosis. There is also additional structure of the synovial joint. So it can be ligaments and tendons, extrinsic and intrinsic. Now, ligaments is connective tissue that holds bone together. Tendons attach muscles to the bones. So if you look at this knee joint, that is synovial joint, we can see, for example, over here, we have a patella ligament, right? This is our extrinsic ligament. We also have inside over here, anterior cruciate ligament and posterior cruciate ligament. Those are intrinsic ligaments. And we will have lateral collateral ligament and medial collateral ligament that not shown on this picture. Those will be extrinsic ligaments. And look over here, we have a tendon. So here's the tendon of the quadriceps muscles, tendon of quadriceps muscles. So that's additional structure, ligaments and tendons. Articular disc, that over here, I think this one, it's gonna be meninges, fibrocartilage between two bones, bursa, right there, or over here, or even here, right? And it's connective tissue sac filled with lubricating fluid. And bursa protects tendons. So you see that's a tendon. And we don't want a tendon wrap directly across a bone. Or over here, for example, we have patella ligament. So we have tendon here that became patella ligament. So we also have a bursa. So we kind of prevent damaging of those ligaments. Right? Because everything that's gonna wrap across a hard surface is susceptible to tears and damages. So we also can have a tendon sheath. That's a connective tissue that surrounds a muscle tendon and contains lubricating fluid as well. Not shown on this model, but we will see on some other diagrams. So here's those are additional structures: ligaments and tendons, articular disc, bursa, tendon sheath. Now, types of synovial joints. Now, again, before we get to this, let's kind of review what we covered so far, right? So we said that if we want to classify joint based on a structural classification, it will be fibrous, cartilaginous, and synovial. If you want to classify based on a functional characteristic, it will be synarthrosis, amphiarthrosis, and diarthrosis. And then we look at 3 types of fibrous joints: gymphosis, suture, syndesmosis, right? So gymphosis, sutures, syndesmosis. Then we look at two types of cartilaginous joints, synchondrosis and symphysis. And now we're discussing in more details synovial joints, that is diarthrosis, movable joint that have a pretty complex structure. They have a capsule, they have a synovial membrane, synovial fluid, articulating cartilage covering bones, and additional structure, ligaments, tendons, articular disc, bursa, tendon sheets that gives this joint stability and allow for a range of movements. And now we're gonna look at different types of synovial joints. So it can be a pivot joint, and pivot joint over here, when we have rounded portion of a bone enclosed in a ring, so like shown right here. So bone rotates within this ring, a rotation around an axis. So it's uni-axial joint. Example would be atlanto-axial joint, connection between C1 and C2 vertebrae, first and second cervical vertebrae. Now hinge joint, shown right here, like a hinge on your door. Example would be elbow joint. Convex, so that's our convex end, sits inside concave end of a bone and works like a door hinge. Example is elbow joint. Condyloid joint, shown right here. When we have a shallow depression of one bone, so here's our shallow depression, and it articulates with rounded, oh, I'm sorry, no, that's, hold on a second. Yeah, this is a shallow depression, I'm sorry, because what is the blue part over here, that's our articular cartilage. Right, so we have shallow depression over here, so we will have depression and rounded surface of another bone. Give us two planes of movement. Example would be metacarpophalangeal joint. So your knuckles. Saddle joint, articulating surfaces have saddle shapes. So it's right here. This one is biaxial joint. An example would be first carpa metacarpal joint of your thumb. All right. So you can see the we have kind of like a saddle shape of this bone here. So that's a saddle shape. Oops. And then another bone sits right here, sits inside. Plain joint. Plain joint shown right here. Articulating surfaces of bones are flat. It's actually, this joint doesn't really allow you for like very drastic movement, but it's still multi-axial joint. In some textbook, it says non-axial. I'm wondering how it can be non-axial if there is a movement. If there is a movement, there is movement along some axis all the time. It's how I feel about it. So multi-axial for me sounds way more appropriate. So you can see, you can move this direction. However, it's kind of like it's in the same plane, right? But you're moving south, north, east, and west. An example would be intercarpal joint, intertarsal joint, and the champion of all the joints, ball and socket joint, that's shown right here. It has some similarity with condyloid joint over here, right? But the differences is, I'm sorry, that in the ball and the socket joint, this round part is really round. And in the condyloid joint, it's rounded, but it's more oval. And if you have like oval structure inside the shallow socket, it doesn't allow you all this range of movement compared with the ball and the socket. This one is rounded head of one bone fits into concave articulation of the adjacent bone, multi-axial. An example will be a hip joint. So this is the joint that the only one, oh, with exception with this plain joint. Yeah, we can just really kind of ignore it. But this is the one that gives you the biggest range of movement. And that would be your hip joint and your shoulder joint, right? So over here, we will look at the different type of movements and name those movements. So movements usually comes in pairs, like a flexion comes with extension. And flexion, when we decrease the angle between two bones, and extension when we increase the angle between two bones. So it can be a flexion of your shoulder, right? Or extension of the shoulder. It can be flexion of the hip, extension of the hip, flexion of the knee, extension of the knee. It can be flexion of your head. So again, this angle, right? You see angle decreases compared with this your angle 90 degree, and then angle decreases between two structures or two bones. So it's going to be flexion and extension when you increase the angle between bones. So here we can see flexion and extension of your torso as well. So the same principle. We decrease or increase the angle, and this is movement of the vertebral column over here. Another pair of movement is abduction and adduction. Now, abduction, if you heard somebody was abducted, means they were taken away. So you pretty much move your limbs away from your body. That will be abduction. And if you bring your limbs, your arms and legs towards the midline of your body, that will be add. So you're adding stuff, adduction. So you can have the same abduction of the hip and adduction. Adduction, so you're gonna move towards the midline of the hip joint. And circumduction is when you have abduction and adduction together, and it's kind of like a rotation over here, but it's not really rotation. Rotation shows right there, but it's abduction and adduction put together will give you circumduction. Rotation, we have lateral rotation. So you do not take the lower limb away from the body, right? You don't, you just rotate it. And if rotated away from midline, it will be lateral rotation. And if rotated towards the midline, it will be medial rotation. So you see also in pairs. So next one, we have some movement that really specific to some parts of your body. For example, pronation and supination. specific to your arms. And so if you are in anatomical position, then your palm is in a supine position. So it's in supination. And if you rotate, I would say, right, rotate your palm towards the posterior side, so you have dorsal side facing anteriorly, then it will be pronation. Also in your ankle joint over here, you have plantar flexion. So plantar flexion up, and oh, I'm sorry, that's a dorsiflexion. Dorsiflexion, because that's a dorsal part. That's the dorsal part of your foot. So you have dorsiflexion. So this one is dorsiflexion, and this one is plantar flexion. I guess we call it flexion because in both examples, we reduce the angle. So is it here or here? So dorsiflexion and plantar flexion. And also at the ankle joint, we have inversion. When you kind of slightly rotate your foot inside towards the midline, or eversion when you kind of like rotate it away from a midline. So inversion and eversion. Protraction and retraction, for example, mandible, right? You can either, you can have protraction of your tongue too. So you take a tongue out of your oral cavities, that will be protraction, and you bring your tongue back, retraction. The same with mandible, you move it up, right, anteriorly or posteriorly. So that's protraction and retraction. Elevation and depression, also shown here with the mandible, but it also can be applied to the scapula. You have elevation of the scapula, depression of the scapula. And apposition for your fingers means you can touch each finger with your thumb. Right. So those are kind of specific movements, like this one, apposition, or dorsiflexion, plantar flexion, inversion, eversion, pronation, supination. So that only applied to a few parts of your body. When, for example, flexion and extension, adduction and abduction, we have more joints that are capable of those type of movements. So here we have pretty much the summary of, we have type of joint like pivot, hinge, condyloid, saddle, plane, ball in a socket, and it give you a description of the joint and some examples, and then that pretty much the end of our first part of the lecture. After that, I'm gonna record a separate video about anatomy of selected synovial joints. Otherwise, this video is really long, and I try to do it not that long, right? As short as possible. But before we finish up, let's go ahead and summarize what we covered. So we're talking about joints. That means we have two adjacent bones come together, and we have some structure between two bones. It can be cartilage, it can be connective tissue, or it can be a very pretty complex capsule, right? So maybe before you thought that joints always mean movement, but that's not correct. Some joints are immovable, some are slightly movable, and some are movable joints. And that's why we classify joints based on their structural characteristic, fibrous, cartilaginous, or synovial, or based on their functional, are they movable or not? Synarthrosis, no movements, because syn actually means together. Synarthrosis. Amphiarthrosis, limited mobility, and diarthrosis, movable joints. Right, and fibrous joints, we're looking like, okay, but what exactly is the structure of the fibrous tissue between? Is it short fibers and it's suture? Are those longer fibers that connects two long bones together, syndesmosis? Or those fibrous joint connects your teeth to your maxilla or mandible, then it's gymphosis. Now, if it's cartilage, then what cartilage is that? Is it hyaline cartilage? Synchondrosis. Is it fibro cartilage? Then it's symphysis. And of course, our synovial joints is a pretty complicated structure that has features common for all synovial joints and has some extra additional structures, right, that we cover as well. And because synovial joints are diarthrosis, they're movable, but we're looking like, okay, are we moving in one plane, or are we moving in two planes, or are we moving in three planes? And, what is the structure of those articulating surfaces? Is it a ball in a socket? Are those articulating surfaces flat? Do they look like a saddle? Do they look like an oval and shallow socket? Or does it look like there is an axis inside a ring? So that's how we classify synovial joint, like pivot, hinge, condyloid, saddle, plane or ball and socket joint. And because synovial joint allow us different movements, let's name this movement. Is it flexion? Is it extension? Is it abduction or adduction? Lateral or medial rotation? Or we might have very specific movement such as pronation, supination, dorsiflexion, plantar flexion, inversion, eversion, protraction, retraction, elevation, depression, opposition. That's how much we covered so far, right? So, and at the end, here's our summary of the joints, right? So that's pretty much it. Thank you for watching, and I hope it was helpful.